Hi everybody. Right, so we're back for another discussion between Imogen and I, and our topic this week is looking at different kinds of tapes that we use with our clients to support injuries and preventing injuries and relieving lots of different things that we might be feeling kind of muscular as well as ligaments as well. So welcome Imogen. Let's kind of chat about our tapes today. So the first one that we're going to kind of bring in is something we might call, I kind of call it K tape, it's well known as, or Imogen kind of uses rock tape. There's lots of different brands out there. I love a tiger tape, which I have got. You can get all different colors, so I've got a nice kind of blue one. You can get all different kind of skin tone ones, and the reason why this is kind of a kind of preference in terms of a tape used most regularly by therapists is it's really kind of flexible, it's very easy to use, and it has kind of multiple kind of uses. You can use it for lots of different things. So I would say in the majority of cases, for me personally and my clients, I tend to use it more, as I say, for kind of muscular and ligament injuries. It helps to ease tension and pain in different areas and discomfort that they might be feeling. It kind of supports, but it gives that element of flexibility. And also, you know, I tend to find it helps with not only just kind of particular kind of injuries in general, but, you know, things specifically could be things like easing the discomfort of a tendonitis, of a fasciitis, and also can help reduce swelling as well. So sometimes we've talked about in some of our previous discussions on kind of swelling and what we use to kind of reduce that. And sometimes it's best not to necessarily reduce swelling too much. We want a little bit of swelling. It's part of the whole inflammation process, and our body's repairing themselves, but actually sometimes that can be quite significant, and so it can be important to try and reduce swelling if necessary in certain conditions. So I'm going to let Imogen say a kind of what she would kind of use that for, because she uses that particular tape most often and the different options she's got with hers.
So for me, I use it similar to you. I like it because it has that flexibility to it. It's not one that restricts movement because it isn't rigid, so it's not something that you're using in terms of sort of support for I'd say controlling movement rather than limiting. So I generally like this one because I tend to want the movement. It's rare that I tend to see people where I actually need to restrict and deload that much. So there's the ways that I tend to use it is from what I refer to as like a cueing effect, because it is so flexible and wiggly. It's more from that sort of sensation side of stuff, or like working with the like myofascia, so the superficial side of stuff. It's that lifting effect, so decompressing and stuff. So I'll either use it to help cue to encourage certain movements. So for example, with like if you've had the sprains or any tendinitis and stuff like this, it will help kind of encourage the movement patterns that we do want, so that you're sort of using it efficiently. Or for some people it might be more of a cueing for the point of going as that reminder that you do need to deload and stuff, so that you're not then overloading, because it just provides that sort of stretch on the skin that you can feel. Or sometimes it's also just the fact that you can visibly see something on there that just adds that sort of like comfort, and that so that people can start sort of moving more freely and normally, because obviously, as we said in past videos, the majority of the time we want movement to help. And then, as you say, the other way that I will use it is for the swelling side of stuff. So you helping to sort of, they call it edema release, I think is, or I prefer it as octopus, because you can use the tentacles and then you can kind of cover over the area of the swelling to help essentially. And again, it's relying on that sort of more lifting effect of the tissue to help drain, is the kind of the principle behind. So where I've got the slightly wider tapes, that's the normal width, so you can see it's slightly wider, and this one's useful that you can cut the tentacles and stuff into, and then you can kind of spread them over the area. It's also useful for covering sort of the larger area, so if people come, I often find that I use it for people with the acute lower back pain, because it will help kind of cover that larger area, again to provide that sort of more sensory side of stuff. So where you're getting the lower back spasms, it can cue that area to just kind of help relax things down. It also creates a bit of a heat effect as well, so that's also helpful for that side of stuff. And the only other way I sometimes will use it, which I guess comes away from the sports, because it is useful for a lot of sporting injuries, and you'll see like often like your runners and swimmers, and I have a lot of like dancers that use it, which as well, for that side of things. But the other side that I find is quite useful is sometimes for those with like you can use it across the neck for like anyone that gets your headache, and so with migraine sufferers and things like this, it might be sort of your tension headaches even, should I say, be useful for, because again it's that lifting effect, that superficial stretch that can sometimes be quite helpful to decompress. So essentially it's the anywhere to kind of either cue to move or to decompress something is generally how I tend to use the tape.
Yeah, definitely. And I think that is why that kind of tape is the most popular, you know, as I say, through therapists, because you can just use it in on so many occasions with all different types of people. Whereas, you know, some of the other tapes, which I use less often, but they are more, perhaps a bit more sports specific, are things like, so the zinc oxide tape is the other one that I kind of use kind of almost like as a second choice. It is very similar to the K tape or the rock tape, but it is just that much more firmer. It provides much more of a firm support. It is designed more, instead of giving that flexibility of movement, like you were saying, kind of reminding you it's there, but it provides a bit of support, but it allows that you know, it's less restrictive. This actually does restrict movement that much more. So again, for particular injuries where we actually don't want them to move through certain ranges of motion at that particular time, depending on the level of injury at that point, this gives a really kind of secure and strong hold when you're carrying an injury that needs a bit more protection at that point in time. It's less stretchy, it's more rigid, it has really good adhesion, so it's quite long lasting, which is great. And sometimes actually this tape can also be used for a different purpose, apart from support, is actually protection of things. So it might protect a small wound of some kind, it might prevent blisters. Again, some people, particularly runners and things where they get that additional friction, might use it to prevent blisters. I know lots of people use plasters and things like this, but this is quite a good kind of option as well. And also you will find in particular sports they will use it to protect hands and fingers as well. So again, you can kind of wrap it round, and it's good to kind of provide support for those areas where they're in kind of usage a lot. Now, very kind of similar to the zinc oxide tape is an EAB wrap. Now, actually, this is where you will find, so it looks very similar to the zinc oxide one, but you can see that kind of red line that goes down the middle of it. And you might recognise that a bit, having seen that on, particularly on people like rugby players. So rugby players tend to have this kind of like often kind of strapped around their leg, for example. It's really heavyweight and very secure, and actually tends to be used for those sports where they've got more tough conditions. So obviously you can imagine like the rugby players where, you know, it is a bit more kind of contact sport, and, you know, they do need it to be that much more secure. This does have its that kind of it's got that in between of a K tape and the zinc oxide tape, so it's got that kind of semi stretchiness to it, but it is very, the adhesive is really good, it's very strong as a fabric, if you like, and you can use it, as I say, kind of wrapping it around thigh areas, and you'll see rugby players even use it around their heads and around their ears as a protection also for ears, obviously, in that situation. So that's really good because it is very long lasting as well. So those are kind of like all my go-tos. The only other thing which I do tend to use sometimes for those people who, with all those different tapes, perhaps get a little bit irritated by the adhesives that I use. So some people might have, you know, a bit like people have an allergy to the adhesives that's on plasters and things like that. If they just get generally irritated by something being stuck to their skin, or they don't particularly like it. Some people don't like the feeling of that being kind of stuck to their skin like that. So what you can use is something called an underwrap. So this is my underwrap here. It's really thin. It's almost like ladies' tights material. It's quite stretchy, it's very thin, obviously it's not sticky at all, but although when you do start to wrap it round, obviously it does start to kind of almost stick to the other bit of fabric as you wrap round. And this underlay, it just creates a barrier basically under other tapes. If you get particularly easily irritated, as I say, by those adhesives, or even by friction as well, sometimes the friction of the movement, and as you know, as the tape sometimes, as they start to wear away around the edges, and you get that little bit of kind of friction between the edge rolling off and going up against your skin. Sometimes that's good for some people, so that can be used as an underwrap and under barrier, if you like, which gets used for those people who perhaps might need the support but are struggling with the adhesives of those tapes. I don't know, is there any other way in which kind of you use tapes, or kind of, or how often, you know, would you say, you know, people often come to me and they'll say, you know, how long do I need to keep using this tape? Should, you know, I keep replacing it, or how often do I need to replace the tape? What would be your kind of advice on that side of things?
In terms of how often, it kind of depends on what's going on and the individual themselves. Because if it's for a sort of injury rehab sort of process, then generally it's kind of at the point of when normal sort of loading and everything like this can commence.
Yeah.
Then I would say it's no longer needed. So to what point that occurs again depends on what we're dealing with. In terms for how long to leave it on with the rock tape, it's generally advised sort of 2 to 3 days, and then after that you want to pop it off and stuff. Or if, like you say, because it goes onto the skin, it's if it starts to irritate, obviously you want to pop it off sooner. Generally I find that it is about the 2 to 3 day mark, and then after that it just the glue wears off and stuff anyway, and it starts coming off and it's easy. And I generally tend to advise, if people are using the tape, to allow sort of a couple of days without it, just to allow the skin to kind of recover from having had the adhesive on it.
Yeah.
A bit like a plaster and stuff as well. Or the other bit would be, is again that I often tend to encourage people, is if they've been using the tape for a while, then to try some training sessions without it, just so they don't become reliant on it.
Yeah.
And so that there is still that sort of time period of moving without anything, so you know what normal is like without having that sort of reliance on something, because we obviously want to encourage normal movement patterns.
Absolutely. And that's exactly what I would say to my clients. You know, you don't want to over rely on these things for too long, because, you know, the human body is amazing and very quickly starts to adapt to having that support, doesn't it? You know, and it's a bit like, you know, people will ask a very similar thing. What used to be used a lot more is they'll have those kind of support socks and things for knees and ankles and things like that, do a very similar job. You do just find with tapes these days that they're just that much more secure. And what you can do is you can manipulate the tapes into the exact positions where you want that support, because it's not always the same for a knee injury, for example. You know, you might need kind of support more laterally, or more underneath the patella or above the patella on the quad tendon. So, you know, you can really kind of manipulate where that support goes, rather than just a general around the whole knee. But like you said, you don't want it to be for long extended periods of time, because your body will adapt to that support, and then it won't be kind of recovering in the way that you want it to. And you want kind of ligaments and tendons to make sure that they're kind of adapting to normal everyday or sporting use, rather than always just feeling they're supported and then they won't adapt to that. And then again, you're more prone to kind of re-injury, for example, if you've had an injury already. And similarly, you know, again, it's great to kind of rely on things like that in certain situations where you know you just need that extra little bit of added support just for that particular day or that particular event, for example. But again, you don't want to continue usage for too long and all the time. You don't want to allow your body to kind of rely on that. You want to then think about rebuilding kind of strength in other ways. So using obviously particular exercises are actually going to build strength around that area, so that you don't continue needing that tape forevermore. It's kind of a, you know, it really is a very kind of short term kind of, not even a fix, is it? It's just a bit like, you know, putting something on for a short period of time just for support, and then, you know, making sure that you're trying to get to the root of any of the issues, kind of on doing other things, as I say, like strength and conditioning, or you know, those kind of things that are going to just improve the situation long term. We don't want to rely on any of these things kind of all the time where we can.
Yeah, I mean, I think that's why a lot of the therapists prefer I think the flexible type, because it doesn't, like, because it is like because it's not doing the sort of restriction of the movement side of thing as much. I think that's probably why, isn't it? Is because
Yeah.
it forces the active movement that little bit more. So, I think even if you have been in the more rigid tape and stuff, and you're concerned about coming completely without, it's when it's like, well, then this is when they can be interlinked and stuff, and try using some of the more flexible tape to almost kind of be like, provide the evidence that it's like, no, the body can move this way, so you can kind of taper it down that way. If coming from the rigid tape straight to movement and stuff is daunting and stuff for some people, you can kind of work your way down in terms of the rigidity and the support and side of stuff.
Absolutely. And I think the last thing to say about these tapes is, you know, it is suitable for kind of anyone as well, any kind of age. I mean, I also use it on kind of younger people who are experiencing kind of lots of different issues, sometimes just some of the growth issues that we have in terms of the Osgood Schlatter's disease, that kind of thing, where they've got those pains, particularly around knee area, is very common. So you can use that to support in the short term. Obviously, that's generally something that they grow out of anyway. So again, that's good because it just provides that short term kind of support for those situations. So yeah, it can be really great for anybody really. So yeah, there's no kind of restrictions as to who.
Not really, like, it's versatile, isn't it? Like
Yeah,
you say,
really
I mean,
versatile.
because it's tapping in that sensory side of stuff and that cueing side of stuff. It doesn't even need to be for someone the pain. Like, it can be that when you're trying to, if you want to concentrate on a certain movement, like say going back to the movement patterns and stuff, if you're wanting to concentrate on certain things there, or improve certain ranges of movement in certain things, it can just help cue that focus in that direction, like without even the pain point of view. So if you're taking it from more of the prehab side of stuff,
Yeah.
which was why it's versatile.
Yeah, really is. So they're great little tools that I love to kind of get out as and when people need that additional support as they're leaving me, kind of after kind of rehab type work, injury rehab stuff, or just general support between kind of sessions, or for particular events. So when I've got athletes who have got a particular event coming up, it might just be, again, we'll kind of have a session where we kind of add that in as something we do before they leave, just to kind of support them, give that additional bit of peace of mind, as well as physical kind of support as well, that they're going to be supported on their run or their, you know, cycle or whatever it might be. So yeah, a good all-rounder. So yeah, if you're kind of someone who needs support with that, you know, both Imogen and I do offer that as part of our services, and we can also kind of talk people through how to, you know, continue going onwards, helping themselves do it if necessary. You know, even if it's for specific events, you can also learn how to do it from us, and then you can kind of use that kind of knowledge to support yourself on individual events as well, which can be really helpful. So yeah, we're here to help you with all your strapping and taping needs. Okay, right. Hopefully that was helpful to some people to learn a bit more about how we use those, what the point of them is, and whether that might be beneficial to them. And we'll try and cover some similar topics in the next video. Thank you for joining me, Imogen, and
Thank you.
next time.